Namaste and Siddhi Pranam. Welcome to your today's topic, which is contraindications and limitations for specific pregnancy conditions. So when we say this, that we are going to discuss about specific pregnancy conditions, it's important to note that most of these conditions are rare, but there are many conditions which are common during the pregnancy stages also. By rare, I mean that these are medical conditions. So it's really, really important for you to be aware of these conditions. But that being said, it's not the case that it is going to happen with every woman. But knowing that and being aware of the symptoms and what the condition is would really, really help you in helping the mothers more efficiently. And at times, really maybe make them cautious of certain symptoms that can go more wrong or worse and can lead to more difficult complications in their pregnancy. So just having an idea of these conditions will be really good. Also, you can go into your manual and read about each conditions once after you have gone through this lesson. You can read, and there is a brief introduction and an understanding of each condition is also given in the manual. Just giving a read will also help you be more familiar, and whenever you feel like that you wish to refer to it again, you always have the manual to go back and go through those conditions once again. So let's dive deep. So the first and the foremost is that breathlessness. So breathlessness during pregnancy is a very common issue that arises due to the growing fetus, the growing uterus, and putting the pressure on the diaphragm and the lungs and reducing the capacity of the lungs to expand and leading to shortness of breath. And this can also be exacerbated by certain positions, including lying on the back for the extended period, and in such a position the uterus puts pressure on the vena cava, which is the largest vein in the body. We've discussed it before also. And this further restricts the blood flow and oxygen to the mother and the baby, and that can also lead to breathlessness. So as a result, lying on the back for extended period can actually lead to increased breathlessness and discomfort, or even at times cause dizziness or fainting. So knowing this and understanding and remembering the causes of breathlessness will actually really help you to identify anything going wrong during the yoga class specifically. Therefore, so I would recommend that avoid lying down on the backs for extended periods specifically during second and third trimester. And it's important that you use props if required in certain positions so that she doesn't feel too much uncomfortable. And it's also essential that mother is given frequent breaks or space and time in between the asanas to breathe well. So just keep in mind that, and never rush through any of the asana or sequences. Rushing is not what we recommend at any point in time during a prenatal yoga class. Prenatal yoga class is a soft and subtle one and designed for relaxation and comfort versus any other yoga class, normal yoga class, which is for other purposes. So one thing that you should also take in consideration is that remember that when you're planning your routine or the sequence of the class, how fast the asanas are shifting or how much time you had. So don't add too many asanas in a row, or just keep the number of asanas less and relaxation practices more. This can also help you avoid any breathlessness during the sessions. Next is bleeding. So bleeding during pregnancy is kind of a a very serious sign, and it can also lead to miscarriage and sometimes require immediate medical attention. And if the bleeding occurs after the first trimester, which is in the later stages of pregnancy, then asanas should actually be stopped immediately, and mother should immediately consult the doctor, which anyway she would, but then you should know that this is the time when it's something very serious and requires doctor's intervention or medical intervention. And then the doctor will actually perform a thorough evaluation of the cause of the bleeding, and depending on the situation, the doctor may recommend the treatment. And even if the bleeding has stopped for a while, then it's still recommended to avoid asanas, specifically if the bleeding occurred in the first trimester. Then it's very much required to take care of this fact that for the first 16 weeks of the pregnancy, and also only after the green signal from the doctor, when the doctor approves, then only any asana practice should be started. So meanwhile, you can always recommend yoga nidra, some meditative practices, or very light pranayamas to the mother. But no asanas until medical clearances, or at least if that was in the first trimester, then the first 16 weeks have passed of the pregnancy. And it's also important that any asanas that put pressure of any kind on the uterus will increase the risk of injury once again, even if the bleeding had stopped in the past. So keeping that in mind, so even though the bleeding has stopped, but if she have had any history of bleeding during her pregnancy journey, then it's important that we do not recommend any hard or too much fast movements or anything that put pressures on the uterus. Next very common situation is breech baby. So breech baby refers to a position in which when the baby is positioned with its feet or buttocks presenting first instead of the head. So ideally, in an ideal situation, whenever the delivery happens of the child, the head of the child should come out first. But if it's other way around, that means the head is upward, that is towards the chest, then and the legs or the feet of the baby or the bum of the baby is towards the vaginal opening, then that means it's a breech baby. So it is in these cases, this actually doctor identifies usually in about about 8 months or something, because until 8 months it's really fine, the baby keeps moving around, but after 8 months, that's when we really need to know if it's a breech baby or not. Because in the case of breech baby, in most likely situation or 90% plus cases, only C-section delivery happens. So we need to be really careful. So this position can actually lead to many complications in delivery, and doctor usually encourage that the baby do turn the head first before the delivery, so they try different things. There are few practices that we should, let's say about squatting during prenatal yoga practice can put pressure on the uterus and may encourage the baby to remain in the breech position. So you should know if the baby is in breech position after 35 weeks of pregnancy has passed, then it is recommended that squatting should be avoided. So any posture which has to do with squatting should be avoided during this phase. And mother should also be constantly communicating with the doctors regarding her practice. If she continues to do prenatal yoga practice even after beyond her 35 weeks, then the advice and medical clearance from the doctor should always be taken. And her keeping in mind of the baby's position, most of the asanas should be modified accordingly. Next is carpal tunnel syndrome. So carpal tunnel syndrome is actually a common nerve condition that affects the wrists and the hands. It occurs when the median nerve, which runs from the forearm to the hand, becomes compressed. So this compression can cause numbness, tingling, and weakness in the hand and wrist. Pregnant women are actually at higher risk for developing carpal tunnel syndrome due to the hormonal changes and fluid retention during the pregnancy. This can actually increase the pressure on the median nerve. So in this scenario, it's important for a pregnant woman to avoid any asanas that can cause discomfort in her wrist area during her prenatal yoga practice. So if the woman is experiencing symptoms of carpal tunnel syndrome, such as tingling or numbness or weakness in the hand or the wrist, certain yoga positions and postures can actually worsen her condition. So therefore, I would recommend that she avoid any poses such as like downward facing dog or side planks or planks, and you would figure out while designing the asanas that what all asanas can put too much pressure, where the entire body weight is on the hands. Basically, those are the positions that I would say, in short, are not recommended. Or you can always take support of, let's say, putting a bow, folding a towel, or giving some soft cushion under the arms. If it's not too worse situation, that can be practiced, or some partial modification can be done if the case is not too worse. But if it's medically declared she has that, then avoid those asanas. And obviously, having a constant communication with your student will only allow you to know about different conditions that she's going through. So one must know first to any help the students with any modification. So you can also suggest any alternative postures. Let's suppose there are, let's say, about 10 students in the class, but only 1 or 2 has this condition. So you can offer alternative poses to that particular students, or modifications can be offered. Next situation is cervical stitch. So cervical stitch is a case where a woman should avoid squatting positions at all times. It's cervical condition. Cervical stitch is also known as cervical circlage. It's basically a surgical procedure where it is performed during the pregnancy to prevent any premature delivery. So in this procedure, a sutura is placed around the cervix to hold it closed and prevent any premature dilation. Usually, it is recommended that women who have a history of second trimester loss, or who has weakened cervixes, in these cases, such surgeries are performed. So it's usually the case that she have gone through any complication in her previous pregnancies due to weak cervix, or some miscarriages that has happened in past due to cervix. Only these kind of situations leads a woman to go for such a surgical procedure. But since the moment you're aware that she have gone through this surgical procedure, it's important to avoid any squat positions such as deep squat, which can actually put excessive pressure on the cervix, and which can be really dangerous for a woman with a cervical stitch. So because this pressure can actually cause the stitch to break, which can result in premature delivery or other complications. Additionally, full squats can also increase the risk of pelvic floor damage, which can be a concern for expectant mothers. So therefore, it is recommended that women with cervical stitches avoid full squat positions and instead opt for more gentle poses that do not put any excessive pressure on the cervix. And knowing that it's important that as soon as the delivery times come sooner, the pressure will be more on her cervical area. So even, any slightest moments which is done in a rush can also result in any complications. So quite a good number of modifications that you will have to do, and especially there are so many labor poses which are squatting and so many other postures which require slight or full squatting. So just being mindful of this will be really, really helpful. Next is backache. Backaches are also a very common problem during pregnancy, especially as the uterus expands and the center of the gravity shifts. This can put added strain on the lower back, leading to discomfort and pain. So asanas or yoga postures that involves forward bends or lying on the back can actually turn on this pain. So it's important that every asana or movements are gentle. And to reduce the risk of backache, it's recommended to use cushion or to support with slight forward bends or back bends. Back bends should always anyway be done very slightly, with keeping the back hands at the back or giving the support of some kind. So forward bends, of course, should be done with by holding a chair or wall or some support or hand of somebody. So because you have to be very gentle with every vertebra in the spine. So any support will be really helpful. So support will actually elevate any pressure on the lower back and reduce the risk of injury also. So wall support, chair support, hand support, all this is really helpful. And it's also important to ensure that the feet are parallel in any position, and that no one leg is stressed more than the other, because a lot of strain is also on the legs, and if one leg is alone taking all the stress, that can again put pressure on the back. And if position is well maintained, this can help the women to keep the body in balance and reduce the risk of straining her back too much. Next would be hemorrhoids. So hemorrhoids are swollen veins in the rectum and the anus that can cause discomfort and pain. So they are a common condition also during pregnancy, which happens due to increased pressure on the pelvic area from the growing uterus. So if she has a condition of hemorrhoids, so in that case, full squats that require any asana that requires full squatting and involves lowering the body as far as possible and then returning to upright position. These kind of postures can put a lot of pressure on the rectal area, which can worsen the symptoms of hemorrhoids. So whichever student of yours that is experiencing hemorrhoids during pregnancy, then avoiding full squats and any other yoga postures that can put pressure on the rectal area should be avoided. So instead, you can help them focus on certain poses that can help relieve the pressure from the pelvic area and promote blood circulation. This can include maybe gentle stretching, gentle twisting, and side forward folds instead of center forward folds. So also, women who are actually experiencing hemorrhoids during pregnancy really need to stay in touch with their doctors and make sure that practicing prenatal yoga is actually safe for them. So this is another condition where medical clearances ideally should be taken. Next situation is fluid retention, it is also known as edema, which is a common condition during pregnancy, where the body accumulates excess fluid, leading to swellings in hands, feet, and ankles. And this condition can actually cause discomfort and even pain, and can become worse by certain physical activities, such as some yoga postures, which put pressures on the affected area. So therefore, if the woman is experiencing fluid retention or edema during pregnancy, she should avoid asanas that causes discomfort and increases the swelling in any manner. So this can include standing postures such as warrior and tree postures, which can put pressure on the legs and feet too much. If they are standing a lot for longer period times, also can put a lot of pressure. So instead, women with edema should actually focus on poses that promote circulation and elevate pressures on the affected area, such as like seated forward fold, a gentle twist, or there is they can turn their legs on the wall and stay with their legs on the wall for a while to allow the blood circulation to happen. All these postures can help. Next situation is high blood pressure. High blood pressure is also known as can actually cause preeclampsia also. So high blood pressure is kind of a manageable situation, but when it turns to preeclampsia, then it becomes a serious medical condition. So which actually can develop during pregnancy and have very, very significant impact on the health of both mother and baby. So high blood pressure can actually increase the risk of preeclampsia, I would say. So this actually, the way it works is that the protein in the urine of the mother is actually high, so that is why the blood pressure becomes higher, and that can lead to a lot of more difficulties and very, very serious impacts, maybe preterm delivery or bleeding, or maybe even at times a woman can faint or go into kind of let's say coma stage or whatever. Like, that's worst case scenario. But to know what postures should be avoided if she has experienced high blood pressure is very important. So any yoga postures that may increase blood pressure in any manner can actually cause discomfort to women with this condition. So it might include standing forward bend, downward facing dogs, or even any minor inversions. So we never do full inversions in pregnancy, but there are partial inversions that is practiced in pregnancy yoga. So any other pressures that specifically holds of any kind, or any other postures where you are putting too much pressure on the heart or the blood vessels, can increase the risk of complications. So instead, women with high blood pressures should actually be focusing more and more on calming and relaxing, and doing only gentle asanas as much as possible. And also, they should immediately stop if any asana is putting them into discomfort or pain. Although this is valid for every situation during the prenatal yoga, but if women have had this condition, then she has to take that care of this particularly. Next condition is preeclampsia or high blood pressure. Preeclampsia is basically a very serious medical condition that can develop during pregnancy and can have very significant impacts on the health of mother and baby. High blood pressure increases the risk of preeclampsia. So they both are not the same, but high blood pressure is actually one of the sign or symptom of risk of preeclampsia. And this is basically characterized by high blood pressure as well as presence of the protein in the urine. And women who are experiencing high blood pressure or preeclampsia during pregnancy, it's important that they really avoid any yoga asanas that may increase their blood pressure or cause any discomfort in any manner. This can include doing standing forward bends, or downward facing dog, or any partial inversions even, which we do in prenatal yoga. And any other posture which actually causes any kind of unease or discomfort. You should know that preeclampsia is that serious that if that occurs, that it can lead to organ failure or blood clotting, which might require very huge surgical interventions at times. It can even stop or not stop, but really hamper the growth of the developing fetus. So there are very, very serious repercussions of this stage. So that's why high blood pressure should be considered very, very sensitively, and should be taken well care if the woman have had a history of high blood pressure prior to pregnancy, and if she continues to have high blood pressure during pregnancy, then that matter becomes more serious and sensitive. So any postures that's causing discomfort, or it's more likely that too much hold can lead to put pressure on the heart, or maybe staying in a one-legged position like tree pose for too long. So all these postures, you should take care that anything that increases high blood pressure and increases blood pressure can actually cause a lot of discomfort. So all this should be avoided in the case of history of high blood pressure, or if it's present in the moment. So instead, women with high blood pressure should actually focus more on relaxing practices and calming practices, mostly gentle asanas and asanas that do not put her into too much pressure at all or any kind of discomfort. Also, though it is valid in most pregnancy cases that any discomfort, she should let you know. But specifically in this case where the woman has had history of high blood pressure, you should be more sensitive be very sensitive towards any discomfort during the prenatal yoga class. So the next is IVF pregnancy. IVF is in vitro fertilization, which is a process by which eggs are fertilized with the sperm outside of the body. That results in embryos, and then they are further implanted in the uterus of the woman. So IVF is that. IVF pregnancy can actually be a very delicate process, and so it's, if you know from women's history or understanding of her medical condition that she has gone through an IVF procedure, quite many extra precautions should be taken to ensure the health and safety of the mother and the developing baby. So for the women who have conceived through IVF, it is advised to avoid any yoga asanas until 5th month of the pregnancy and make sure that the pregnancy is settled. That is very, very crucial in the IVF pregnancy. To avoid any asanas till 5th month is recommended because the first trimester is a very critical time in the development of the baby, and any physical activity that is too strenuous can actually risk into miscarriage. So in the early stages of pregnancy, women have if the women have conceived through IVF, should actually focus only on very gentle or relaxing form of exercises, let's say just walking or slight stretching or maybe just some pranayama, yoga nidra. All these relaxing and calming practices can be done. And so they should actually prioritize their own comfort and safety and avoid any physical activity that puts them into any pain or discomfort. The next situation is faintness and low blood pressure. Faintness and low blood pressure are actually also very common symptoms during pregnancy and can be caused by a variety of factors such as dehydration, hormonal changes, or the growing uterus is putting pressure on the blood vessels of the woman. These symptoms at times can be dangerous for mother and the baby, so it's really important to take extra precautions to ensure the health and safety of the mother and the baby. So women experiencing faintness or low blood pressure during pregnancy should actually take care while changing the asanas positions specifically. So if there is sense of dizziness while shifting from one asana to the other, then they should actually lie down on the side for a while, and they should really immediately inform you if they are experiencing any dizziness. So that should also be communicated specifically with the mothers who have any low blood pressure issues in the moment. Standing and laying on their back for a long time or any asanas that cause feeling of fainting should also be avoided for women with low blood pressure. Because these poses can actually decrease the blood flow to the baby and increase the risk of complications. So also avoiding any practice or any asanas that causes dizziness at any point in time. So women with low blood pressure should actually just focus on promoting the blood flow and doing the asanas that help regulate her blood pressure. So gentle forward folds or spinal twists with seated spinal twists, like let's say side spinal twists very gently can be, all this can be done. But dizziness is one, like the red flag that you should always look out for, specifically in case of history of faintness, which happens specifically during the first trimester a lot with the women. Dehydration is also one thing, if it's taken care of well at all times in the pregnancy, can help avoid such situations, especially during the practice of a prenatal yoga class. Next situation is miscarriage. So a previous miscarriage can have like a traumatic and emotional experience, can be a very traumatic or emotional experience for a woman, and it is understandable also that she might be very cautious about engaging in any physical activity in the subsequent pregnancy. So during a miscarriage, the uterus contracts and expels the pregnancy, and these contractions can be triggered by physical activity or too much stress and certain other factors also. So for women who have experienced previous miscarriage, it is advised that to avoid any yoga asanas until the 16th week of her pregnancy, just to ensure the health and safety of both mother and the baby. This is because the first trimester is a very critical time for the development of the baby, and any physical activity that is too strenuous can increase the risk of complications. Next would be palpitations. Palpitations are irregular or rapid heartbeats, and they can be caused by a variety of factors such as stress, anxiety, hormonal changes during the pregnancy. And palpitations can actually be uncomfortable and even scary, and they can also impact the health and well-being of both the mother and the baby. So for the women who have experienced palpitations during pregnancy, it is important to avoid any asanas that causes too much exertion, and this is because high intensity physical activity can put extra stress on the heart and increase the risk of palpitations. So instead, women with this condition should focus on gentle and relaxed form of asanas and more sort of cooling and calming pranayamas and other relaxation practices from yoga, which includes, let's say, gentle stretching or just rotation of limbs in different manners. So there are many very relaxing asanas also that can be done. And in addition to avoiding the poses that causes exertion, women with palpitations should also prioritize their comfort and safety and avoid any discomfort and pain at any point in time. Once again, this is valid for everyone, but in case scenarios, one needs to take care a lot if they have some history, medical condition. And they should also make sure that they are hydrated and feeling cool and well ventilated and oxidized during the entire yoga class. So they're able to breathe well, they have the sense of coolness in the body. That is also a sign that they are doing fine and well. So you can guide them that if they start to feel heat up at any point in time, or their breath or going too much out of breath or dehydrated, all those are quick signs to catch that their heartbeats is going to increase. Next situation is placenta previa, which is a condition where the placenta grows in a low-lying position in the uterus and covers part or all of the cervix. So this condition can cause serious complications during pregnancy and delivery, and it requires careful monitoring and management. So women with placenta previa, it is important to avoid any asanas that can cause exertion or any full squatting pose, because her placenta has actually come near to the opening, the cervix opening. So we wouldn't want any preterm delivery where the placenta is delivered first, and so that those are the major complications of the placenta previa. So if the placenta is not positioned right, and we know that after the first few checkups, then full squatting or any asana that requires too much squatting or any high intensity activity can actually put extra stress on the uterus and placenta and increase the risk of premature labor or bleeding also. So avoiding full squatting postures or any high intensity asana will be recommended. And women with placenta previa should also consult their doctor first before starting any form of prenatal yoga practice. So ideally, you should take medical clearances from the women who has this condition and is wanting to practice prenatal yoga with you. And even if they have the medical clearance, they should actually go for regular checkups with the doctors and monitor the position of the placenta continuously. Next situation is pelvic pain. For some women, pregnancy can also come accompanied with pelvic pain. So this is a pain in public, the pubic region, or also known as groin, we call it groin area, which can make physical activity very uncomfortable or even painful at times. So in such cases, it's important to be mindful of what exercises and postures are safe and which should be avoided. In case of pelvic pain or discomfort in the pubic or groin region, it's recommended to avoid any asanas that causes discomfort, and also any wide leg poses which requires too much pelvic opening can actually cause a lot of discomfort for women with pelvic pain. So this is because wide leg poses and certain postures can put extra pressure on the pelvic region and increase the pain. So instead of that, women with pelvic pain should actually focus once again on gentle asanas or any asanas where they can take some support and give the body some support. So prenatal asanas that target backs and hips, such as like pelvic tilts and cat-cow stretch and butterfly stretch, all these can be little helpful there. They can also try doing gentle stretches and exercises for elevating pain, such as like pelvic floor muscle exercises, which can help improve stability and kind of elevate some of the discomfort. We will have a separate chapter or module on pelvic floor health, and I believe we'll go detail into that problem and what all can be done in that chapter. Next situation is preterm labor. This is also a very serious condition that occurs when a woman goes into labor for 37 weeks of pregnancy, putting both mother and the fetus at risk. So in such cases, it's important to be very conscious of all kinds of physical activities, and if the woman chooses to practice prenatal yoga, if she has been in the condition of a premature labor, then this should require a medical clearance, and doctors should approve her to practice any kind of physical activities in order for her to be able to practice prenatal yoga any further. And if she gets that approval that she can continue to practice some prenatal asanas, then also it's important to avoid any squatting positions or any asanas that put any extra pressure on the pelvic region, or because any pressure on the pelvic region, any extra pressure can actually increase the risk of premature labor. So women with preterm labor should really be just focusing on very, very gentle postures, child pose, or relaxing postures, relaxing yoga practices. That's what should be focused upon, and that too only after medical clearances. Next is varicose vein. So varicose veins are swollen and twisted veins that occur when blood pools in the veins and put pressure on the vein walls. This can cause discomfort, pain, and swelling in the legs. So varicose veins are more common during pregnancy due to the increased blood volume in the body of the woman and the pressure of the growing uterus on the veins. So for women with varicose veins, it's important to avoid long-standing periods or any yoga asanas that can worsen the symptoms of the varicose vein, which put lots of pressure on the legs in any manner. So any asanas that is even causing too much discomfort at any point in time or causing any pain should be avoided as well. Also standing on one leg or putting intensive pressure on one single leg, even postures such as warrior pose should be modified to reduce the pressure on the legs. So it's recommended that women with varicose vein should also take advice from the doctor before starting the prenatal yoga. So there are modifications that can be often offered to the women with varicose vein, and so there are different forms like mostly sitting or supine asanas can be more comfortable for women with varicose vein. So all those can still be practiced, and certainly the other yoga practices such as breathing, pranayama, and yoga nidra, mindfulness meditations, all that relaxation practices still can be very actively used in the cases of the patients of varicose vein. So next condition is toxemia. Toxemia is another name or interchangeably used for preeclampsia, but it was historically used to refer to condition which is all the conditions or symptoms of preeclampsia plus any toxic exposures to the women during the pregnancy stage. So that was also referred to toxemia, but nowadays in the medical healthcare situation, terminology, toxemia is kind of old vocabulary, and so most cases preeclampsia is the new word that is referred to, but you should also know toxemia as one of the medical conditions whenever referred to. So it's much similar or another name for preeclampsia, you can say, but sometimes can involve, let's say, toxic exposure to mother in any kind. Next is sciatica. Sciatica or slip disc are very common conditions that can cause lower back or leg pain during the pregnancy. So sciatica occurs when the sciatic nerve, which runs from lower back to the legs, is compressed or irritated, while the slip disc occurs when one of the intervertebral discs in the spine bulges or ruptures and puts the pressures on the spinal nerve roots. So when practicing prenatal yoga for the woman who has sciatica or slip disc issue, special precautions should be taken to keep the mother safe and comfortable while practicing all the prenatal asanas. So in most cases, the mother should actually make sure that she keeps her feet parallel and avoids straining one leg then the other, and try to balance the stress on both the legs well, and this can actually help her reduce the risk or enhance the pain in any manner. So she can use props more often, like cushion and maybe support whenever required. And if she is doing poses like child pose, then just put a cushion underneath her head to just keep her neck or the back very straight. We anyway avoid too much lying down position. So if requires, she can always support her lower back also with cushions or in any other manner. So any positions that has strong or very deep back bends. For example, we don't do deep back bends anyway in prenatal yoga, but even slight back bends should be done with a lot of cautiousness for the women who have sciatica pain or the slip disc issue. So once again, focusing on stretching, gentle stretching, restorative poses, without causing any muscle discomfort can be recommended for the women with sciatica pain. Next would be sacral-like pain, which is the pain in the lower back and hips caused by strain or irritation in the sacral-like joint. So in this case, any wide leg forward bends should be avoided, because such kind of poses can actually put excessive pressure on the lower back and the hips. So they should follow more or less the guideline with women with sciatica or backache otherwise. But in this case, since the pain also goes into the hip area, so even too much wide opening postures can also cause discomfort for these women. So just moving, being gentle with the back, doing gentle postures that can help relieve some stress from the back are recommended for women with backaches and sciatica pain or sacral-like pain. Next would be symphysis pubis dysfunction. So it's also known as SPD in short. It's a condition that affects some women during pregnancy, which can be characterized by pain and discomfort in the pelvic area, basically. So this condition can be caused by hormonal changes or increased pressure on the pelvic area due to the pregnancy. And this can make very difficult for the women to participate in physical activities or yoga asanas at times. So engaging once again in any posture that put too much pressure on the pelvic area, avoiding extreme lunges or pigeon pose, horse pose, squatting asanas, anything which puts strain on the pelvic area basically is not recommended in case of women with SPD. Also, wide leg postures like avoiding too much stretching in the leg area, which opens the pelvic too much, can also cause discomfort, such as let's say triangle pose. So this posture should also be can be avoided not to put too much of the strain in the pelvic area. And instead, once again, we should focus on more asanas which can release the tension and discomfort from the pelvic area, such as cat-cow and child pose and butterfly posture. All this can actually help. And we can, whenever required, use more blocks, blankets, or other props to give additional support in some of the asanas wherever required. Next condition is diastasis recti, which is a condition that affects some women during pregnancy, in which the abdominal muscles separates along with the midline of the belly. And this condition can cause weakness and instability in the abdominal area, and it increases the risk of low back pain and other musculoskeletal issues. So gentle versions of side bends or back bends and twists should be done, as these poses can help strengthen the abdominal muscles and improve the stability during the pregnancy. But however, if there is any discomfort with the woman with diastasis recti, should avoid these postures altogether. If she feels too much pain or too much discomfort, you can completely avoid postures or asanas that put pressures on the abdomen. Instead, she can focus on asanas that can help her stabilize the abdomen area, such as like certain pelvic tilts and transverse abdominal hold. You can search for that, how it is done. And also use of props and blankets to modify postures to avoid additional support is always helpful. Next would be placenta abruption. Placental abruption is critical condition once again. It's a condition where the placenta, which is responsible for supplying nutrients and oxygen to the baby, becomes partially or completely detached from the uterus. So this separation can lead to a compromised oxygen supply to the baby, and it really requires immediate delivery or complete bed rest at times. So in this case scenario, prenatal yoga is completely should be avoided completely, and this requires consistent medical care, and any strenuous activity, if it's yoga or any other physical activity, can actually be very, very dangerous or risky for women with this condition. So if that being said, if someone with this condition comes to a class, requires medical clearance, very simply. So next condition is amniotic fluid leakage. This is a condition where the amniotic sac kind of ruptures, which has a fluid-like substance filled, which is surrounding the baby, and this can even occur gradually at times, and with a constant sensation of dampness or suddenly kind of gush at times. So really depends on what kind of leakage the woman is experiencing. But it is also a critical event and often associated with an onset labor. So women experiencing any fluid leakage during the practices of asanas should be very, very cautious, and all the signs should be of any leakage during the yoga session should require very, very prompt intervention. Immediately all physical activities should be stopped, and urgent medical condition urgent medical attention should be sought. So you should ideally call an ambulance so that she does not have to move even to go to her car or any, so that she's carried especially if there is a complete leakage of the fluid. Because if the leakage happens prior to the 37 weeks of pregnancy, then the head of the baby is not settled. When the head of the baby is not settled in the cervix area, what happens is that losing the amniotic fluid can be very, very risky. If that happens even, let's say, in the mid-pregnancy, then it's way more dangerous. So knowing that, and if that happens or occurs in between a yoga session, then it will again become a responsibility of yours as a yoga teacher to take appropriate actions immediately. So that should that may require you to call an ambulance immediately. The next one is blurred vision. So during the pregnancy, due to dehydration or in severe cases of preeclampsia or too much high blood pressure, can cause at times blurred vision also. So it also once again requires prompt medical intervention, and to just assess the underlying cause immediately. So if the woman is experiencing blood vision in your class, once again, she should actually right away go to the doctor and consult the doctor to know the underlying cause, so that if it's a severe case of preeclampsia, it can be avoided and at a very prompt time. So in this case also, you might require to give her support from the family, or you might have to take her to home, doctor, wherever. Whatever might be required in such a situation should be done. And obviously, if she says that it was only for a few seconds that she experienced blood vision, then also any physical activity or any asanas should be stopped immediately, because this can be a symptom of a very serious condition at the background, so it should not be taken lightly at any point in time as well. Next is Braxton Hicks. They are also known as kind of fake labor at times. Braxton Hicks are kind of contractions, or you can say practice contractions for the uterus, which is usually felt higher in the abdomen and not affecting the cervix basically. And they are common during pregnancy, but may also become intense at times. So labor contractions, which are real contractions, on the other hand, resemble menstrual cramps and can indicate onset labor. So just knowing the difference is also important. So both of them can actually occur during a yoga session. So usually practicing prenatal yoga is generally safe, even if the woman is having Braxton Hicks. But if she experiences 10 contractions in an hour during exercise or like a asana session, she should stop the practice and consult the doctor. So because in the last month, specifically in the 9th month, a lot of women go through Braxton Hicks, and for them to identify where the contractions are occurring, whether they are in the abdomen area or the cervix area, that can actually help them differentiate. But also at the same time, it's important not to take it lightly. If there are more than 10 in an hour, then medical advice should be taken. So labor contractions are basically, if they are actual labor contractions, then they will be like cramp-like sensations deep in the lower abdomen, and typically signaling that the labor has started. And if that is the case scenario, and specifically the woman is in the last stages, then it might obviously require immediate medical attention. But if the labor contractions also feel similar and too much, even in the mid-pregnancy or prior 37 weeks, then also immediate medical attention should be sought for this case scenario. Next is pressure and urgency sensation. So feeling intermittent pressure with an urgent need for a bowel movement or urination may indicate potential complications and requires attention. So if women is practicing prenatal yoga while experiencing this, it should be discontinued. And if the pregnant woman feels intermittent pressure accompanied by an urge to immediately release the urine, then she should require to consult a doctor in this case scenario as well. Next is changes in the body temperature. So sudden sensations of overheating or getting too cold and clammy can be indicated of underlying concerns and might be a signal to need to stop the asana practice immediately. And if the pregnant woman, if the woman is facing rapid body temperature changes, specifically during the asana practice, then she should stop practicing it and consult the doctor. And if the body temperature exceeds 101 degree Fahrenheit for an extended period, she will again is a very, very serious condition where she should immediately contact the doctor. Next is swelling or edema, which is a common scenario in pregnancy, which happens due to fluid retention. We have discussed this previously also in this chapter. Just repeating it. So while it's really normal, but sometimes it can indicate preeclampsia when accompanied by high blood pressure. So if a woman has fluid retention, which is edema, but she also at the same time has high blood pressure, and the test results also shows protein in the urine, then it can be indicative towards preeclampsia and hence require immediate medical condition attention once again. So generally, prenatal yoga is actually safe for women with fluid retention and edema. However, if it's accompanied by high blood pressure, then the concern is there, and that should require medical attention, and in that case, all yoga practices should be ceased at the same point in time. Next is gestational diabetes, which is a form of diabetes that develops during pregnancy and is assessed between 26 to 28 weeks of pregnancy. It is assessed through blood tests and it usually involves drinking a very sugary drinks to assess the level of diabetes in the woman's body. This is generally, like if a woman has gestational diabetes, it's generally safe to practice prenatal yoga, but some modification based on the discomfort of the women can be done. But at the same time, if she has high blood pressure or any other condition also, then that can lead to preterm labor or premature delivery. So this is one concern that needs to be kept in mind for the women with gestational diabetes, which is nowadays unfortunately a common scenario. 1 out of every 5 or 4 women with pregnancy has gestational diabetes. So this also requires a lot of proper diet control, where too much of sweet dishes should not be consumed. So we can later discuss in the nutritional chapter anyway, but other cares are also very required in order to avoid any risk to the baby or risk of premature delivery. Next is phlebitis. Phlebitis is a vein inflammation that may occur with a blood clot, presenting symptoms such as like swelling, heat, pain, itchiness, or redness, especially after the asana practice. So if that is the case, then once again, immediate medical attention should be sought by the women experiencing these complications after the practice of asanas or any other physical activities. Next is leg or feet cramps. So leg cramps are also common in pregnancy and sometimes can be linked to potassium or calcium deficiencies. Sometimes it is linked to some sciatica vein related issues also. So while if the woman has leg cramps or feet cramps, it's okay and it's really fine to continue practice the prenatal yoga. But if they persist, then she should consult the doctor before continuing the yoga. So understanding these definition and contraindication is very crucial for you as a prenatal yoga teacher, and it's also crucial that you understand these conditions very well so that you can create a safe and supportive environment for your students. So I wish you all the luck with this, and may you have deeper understanding so that you're always supportive in your services and offerings to the students. Thank you and namaste.